Here's a quick note, too. Dr. Jonathan Tripp in his office. They have a couple of things going on if you're thinking about your skincare. One is the cosmetic seminar taking place today. That's at 7 p.m. Limited seating, and you can call the doctor's office if you'd like to RSVP. He'll tell you about that in just a moment. And then in a couple of weeks, they have the peel party coming up. Sometimes that takes a little explanation because it's got nothing to do with what is it, the actress Amanda Peel or whatever her name is.
No, this is all about being appealing.
About your skin on your face.
Yeah, no, the Peel Party is September 20th. It's on a Thursday night. It actually starts at about 3 p.m., but it is by appointment only. What's fun about the Peel Party, and the reason we call it a Peel Party, is you're going to get a bunch of different treatments. You're going to get a chemical peel for the face, the hands. You get a consultation that we're going to talk about your skin and what you want to accomplish. And all of these things really, I don't even have it all together, but there's about $300 worth of treatments. You do need to pay $100 to be part of that Peel Party. Um, and almost everybody that's attended those parties, wants to do it again, but we actually only offer a one time unless you're bringing a new friend to another Peel Party because there's such good discounts. But it's a lot of fun, and there's you actually get to see some changes and get a feel for how non-threatening these treatments really are, but how good they are. So that's 20th of September.
Tonight being the cosmetic, I saw a cosmetic party yesterday. I was at on Addison Avenue at a light, and the woman in a white Altima next to me was applying makeup. So
there you go. Hopefully, how much makeup did you have, Bill?
Yeah. But cosmetic seminar today. If people would like to know more about these, they should call the office.
Yeah, the seminar there's no cost. We do want you to call an RSVP because there's limited seating, and that is tonight at 7 p.m. It is essentially learning about the things that we do and the fun you can have. It is one where the majority of what we talk about comes from the audience as far as what you want to know about, but I'll give you some ideas, things like how to get rid of dark spots, how to get smoother skin. Let's see, how to get rid of wrinkles. We talk about fillers, which is the kind of things that put some definition into the lips. In fact, people often think of Angelina Jolie's lips or somebody that has big duck lips. Let's see, Goldie Hawn, that would be a bad example. So that's not what we're doing. When we do fillers, we're really doing very small finesse, helping get rid of wrinkles or improve, shall we say, definition. And if anybody knows that you've had it done at our office, then I didn't do a very good job. Excuse me, that's the smoke back in the air for me.
Very true.
Let's see, so tonight really is just come have some fun, but please call. Our phone number is 208-933-4400. That's 208-933-4400. If you're interested in checking out our office, you can also reach us on the web at, maybe you can't reach us. It's tripvalleymedicine.com, and Facebook is Trip Valley Medicine, so you can reach us any of those ways. But tonight and, Thursday the 20th will be a lot of fun. Please bring a friend. It really is the fun side. Other than seeing kids, this is the funnest thing I do. But kids actually still trump this for me.
We've got about a minute and a half before the break, so I'm going to flip a couple of things in your agenda, and maybe flu shots first, and then we'll get to the Medicare update.
Yeah, flu shots. Quick advice: get them at your doctor's office. Not that pharmacies don't do a good job of giving the shots, but when you get them done at your doctor's office, if you have illness, if you have other problems through the rest of this flu season, that just gives you much better care, continuity of care. You know what's been done. There's not a lot of guesswork, and things can be more quickly and more accurately diagnosed. So flu shots are better at your doctor's office.
Is the vaccine actually out and available?
It is coming out in about the next 2 weeks. So by the end of September, we'll have it in our office, and it may already be available in some of the pharmacies. But depends on the year. But the last probably 2 out of the last 3 years, the flu shot has really helped knock down what has been very health-threatening flus that have gone around. There is 1 year, about 2 years ago, that the flu shot itself didn't help what with what was the major flu that year. It helped with minor stuff, but the hope is that last year's major flu viruses, which were put into this year's vaccine, will help you avoid anything more serious, especially as the flu viruses mainly mutate from year to year. And so if you get last year's, you have a very good chance that you're going to have a very minimal influence or none at all with the
And we should point out,
immunization.
even for the cost, I mean, the cost is relatively low. And when you get these, even if you only get protection against some strains, it's
Right.
for the cost, generally $10 for most people.
Yeah, I don't. A lot of the insurances pay for it, so there's almost no cost. But my memory is in the past, the flu shot is in the neighborhood of about $30, total. So no, these are not hundreds of dollars like your shingles vaccine.
We've got more coming up with Dr. Jonathan Tripp. Better Health with Tripp Family Medicine. Keep in mind, life's too short not to feel good. It's 8:40, and we're at 52 on Magic Valley this morning as well with Bill Cully on News Radio 1310 KLIX and newsradio1310.com. The doctor has an update on Medicare coming along. You might want to hear this one. Dr. Jonathan Tripp in the studio with us today on this Wednesday morning. It's Better Health with Tripp Family Medicine. If you've got a question or comment, in fact, for the doctor, 208-736-0300. Although you can also call his office, too, and they'd be glad to help you out. We should probably point that out one more time again, that you're on Fillmore Street in Twin Falls.
Yeah, we're across from the post office on the north side of town. And our phone number for calling there is 208-933-4400. That's 208-933-4400. And, as they say, callers are waiting, or what is it? Operators are waiting to take your call now. So,
well, this one, we've got to take a couple of minutes at least for you to talk about something here about a political update for Medicare.
Yeah, no, I know you talk about a lot of political things on the show, but for me, I rarely bring that up. But this is out of this is an announcement from CMS, who is Medicare and who mandates pretty much what's going on with doctors nationwide. So this is, real recent announcement in August, actually. And by the way, as I tell you that it was announced in August, and then you find out that the period for public commentary only goes till September 10th, it's right there kind of sets me off and saying they have a program, they have a plan, and they really don't want a lot of feedback on this. But let me tell you a website to do some feedback, because those of you that have Medicare need to pay attention to this. And it's called regulations.gov. So I'll bring that up at the end. But this is where the comments to this proposed rule can be received. And we'll see if they actually pay attention to any of them. But here's what the proposal says. It says doctors could spend less time with their electronic health records under Medicare's proposed physician fee schedule for 2019. So we're talking next year. This is not long distance. But it sounds like they're saying, hey, we're trying to help doctors have more time, which, as you read the rest of the article, you'll find out there's no proposal here really to speed up doctors' time. But what it says is the proposal will condense all 4 levels of what's called an evaluation and management code to one level with one payment. There would no longer be higher payments provided for high levels. Okay, let me quickly explain. When you go to the doctor, there is not one price. And this is one of the problems that patients get so upset. They say, well, how come you can't tell me how much it's going to cost when I come in? And the answer is it depends on the level of medical care, or how many things we talk about, or what is called the medical decision making. So, if we're talking about chest pain, that's a whole different level than a runny nose. Okay. But when we talk about hypertension and diabetes and my allergies and my ingrown toenail and the spot on my back, now all of a sudden we've got multiple things, and that's a much higher level equivalent to the chest pain diagnosis. So what Medicare has done, and insurance companies follow suit, is they say, we will pay you at a different level because you're giving different levels of care. So what CMS is proposing, so this is Medicare, that they'll have one level, one payment, no longer have to worry about what level it is. Well, the nice part is if that were true for everybody, I could tell people, this is what you're going to pay. Oh yeah, I can't do that either because your own insurance company changes how much they pay compared to the next insurance company. So what this will effectively do is when you come in and you have more than one issue to talk about, If you have that mole you want to talk about that's on your back, that's it. You're done. You cannot go on to, and by the way, I need a refill on my, and you fill in the blank, one of several medicines. You can't do it. The reason why is because they're only going to get paid to see you for one thing. So if you are a patient, you're going to be very frustrated with how many appointments you're going to have, and very brief appointments, really brief appointments, for this system to work with doctors. And I think what it'll do is it'll push more and more doctors out of accepting Medicare. Medicare is already almost the lowest payer in the nation. You have TRICARE that's less, you have Medicaid, depending on the state, that's less. But Medicare is the standard for the lowest payment. So people think, well, I've got this great coverage. My Medicare will cover all this stuff, especially if I have a secondary. But the truth is compared to Blue Cross or Aetna or others, you're actually paying less to the doctor. So the doctor's motivation to see you is less and less. And with this kind of a proposal, essentially, you as a Medicare patient will be limited to one item for one visit. Yep, I can see you next week about that blood pressure medicine you wanted to renew. Oh, you have diabetes too? Oh, well, we'll have to make another appointment for that. Can you see how frustrating that's going to get to patients and doctors? But CMS is putting out this proposal and saying, look, we're going to simplify things. We're going to make it easier for the doctors. We're going to give more time with their patients. But really what they're saying is, we're going to only allow you to see them for one thing, and we're going to pay you less. You think that's going to motivate a doctor to spend more time with you? I don't think so. So if you'd like to respond to the government on this, the comments will be accepted at this website, regulations.gov, and only until September 10th. So you have all of 5 days to figure this out. So my recommendation is this might be worth a visit on the web or a call to your congressman and your senator, and let them know this is going to change your life as a Medicare patient, and it's going to change who will accept Medicare patients, all in the name, under the auspice of we're going to save patients, or we're going to save doctors time. So that's my political side, because it's going to make a big change. And if they get this through, it starts next year. So
And we should add too, if check out the website, make your comments there. But the more calls all of Mike Simpson and Mike Crapo and Jim Risch all have offices here in Twin, so you could call the offices, the local offices, and offer your thoughts. That'll get passed along.
Yeah, no, it will. And I realize that I'm one voice that luckily I at least have a radio show to bring this up. I'm only one doctor, but the reality is this was brought up recently, and they're going to shut down the comments in 5 days. And so, what that tells me is that CMS is planning on moving forward with this unless they have, a full rebellion. So it will make me reconsider what I do with Medicare patients. And, a lot of our listeners are Medicare patients.
Want to mention it's 849. Telephone number is 208-736-0300. Dr. Jonathan Tripp from Tripp Family Medicine in studio with us on Better Health from Tripp Family Medicine. Bill Colley along too for the ride. Okay,
so now to our real topic.
You wanted to mention, because you came in and you mentioned the smoke this morning.
Yeah.
And I've also had the last couple of days a runny nose and some sneezing. And I don't know if it's the return of the smoke or not, but definitely it's something seasonal.
Well, here's what's fun. This was almost exactly a year ago that we talked about the same topic. But my title was "Help! I'm Under Attack: Seasonal Allergies." We had about 3 or 4 days with very low or no smoke, really good air quality. And what's really interesting is, for me, I had no congestion, no throat drainage, no irritation. And what the funny part is, my family, we tend to sing a lot, in the car or whatever. And I could not hit my normal higher notes, for the prior 6 weeks. And all of a sudden, for about 2 days, I could sing a lot better, which was perfect for going to church on Sunday. But after that, I'm already back to where I was a week ago. And it was a patient that told me, oh, the smoke's back. And I didn't even know it because it was a clear sky. But sure enough, by yesterday afternoon, I was in trouble. So smoke is one thing, but we're talking about fall seasonal allergies. So we're talking about, ragweed and sagebrush and, pollens coming from all kinds of flowers and maybe even grass. So, and dust is abundant because we haven't had much rain. So some of the symptoms that are allergies that do cross over with a cold, but symptoms that are allergies And then I'm going to tell you the symptoms that are not associated with allergies because people confuse, is this an allergy or is this an illness? So the allergies are runny nose, watery eyes, cough, scratchy throat, nasal congestion, headache, ears that feel muffled. You can even have a little bit of imbalance if your ears are struggling. And so these can be annoying symptoms or they can really be debilitating. Symptoms that are not allergies, these are the easier ones to remember, are fevers. Fever is not an allergy symptom. Chills, body aches. These are definitely symptoms of infection. So all the ones above can be an allergy or a cold, but the fever, the body aches, and the chills do not represent allergies. So, a lot of people say, oh, I just have allergies. Well, have you had a fever? Yeah, that's not allergies. Okay. So, why doesn't everybody have, big allergy problems? And I claim not to, but boy, I'll tell you what, I guess I got a smoke allergy. Um, and it is essentially your immune system's response. Some people have what I'll call a hyperactive or a hyperdrive immune response. Anything that it believes is attacking it, it responds, with great guns or in a big way. That now you get a lot of there's there's a lot of things. There's histamine, there's cytokines, there's leukotrienes, and all these words basically are different types of ways that your immune system attacks an invader. So if a pollen off of ragweed is viewed as like a virus or a bacteria, your body responds to that, trying to kill it. And as part of that response, you get swelling in the tissues in your nose, in your throat, in your, uh, you know, those are the main places, but lungs as well. And with that tissue swelling, now it weeps because there's leakage of fluid. And so that inflammation, that swelling, that leakage now gets the whole nose going, your lungs, you have to cough. And now you got irritation from the drainage. So now you get a sore throat, or your eustachian tubes from your ears tend to swell and plug up and put the pressure on your ears. All of this is just kind of a chain reaction. So some people, hyper react to allergens, whereas others have a lower response. They probably are responding, but not in a way that gives them enough to have the swelling, the congestion, the weeping, and the ears plugged. And so that's kind of my quick take on why do some people get it and why do some people not. And thank goodness, we don't all suffer like my wife has been doing for about the last week or so. She's been struggling with. She's doing antihistamines. She's doing saline nasal rinse. We started her on a nasal steroid. These are all good things you can do at home. You don't need a prescription for a saline rinse. You don't need a prescription for nasal steroids anymore. It used to be all prescription. Antihistamines, we have a wide variety of good choices, once a day or even shorter term ones. So things like Claritin, Allegra, Zyrtec, Xyzal, those are all once a day antihistamines.
We've got a caller with us. Caller, you're on the air with Dr. Jonathan Tripp at 854.
Good morning. Thank you for the discussion this morning. With the allergies, is a symptom extreme fatigue? I'll listen on the radio.
It sure can, because when your body's responding to allergies, especially if you know you have these other more obvious superficial ones like the nasal congestion, the scratchy throat, the cough, your body is fighting as if it's fighting an infection. And that takes energy and takes effort. And so as a result, you, after especially a few days, can feel quite run down as if you'd been ill. So your body uses that same energy.
You were also going to talk about prevention. It's just avoiding it. Now, I sailed on the Missouri River a couple of weeks ago, and I mean, you could have cut the smoke with a knife. And but I was fine. But there were other people on the boat who were having some issues, and so they should have been probably indoors on a day like that.
So just smoke in that area.
Yeah.
Okay. Yeah, there's things you can do. Staying indoors, especially if you have an air conditioning system, changing the filter, because the filter, especially if it is a quality filter, really filters out a lot of these allergens, a lot of the particulates in the air. And so if you have less in the air, you have less in your nose.
There was a recommendation from State Health Department a couple of weeks ago too, maybe to avoid vacuuming carpets.
Yes. Oh,
I
yeah.
was surprised by that one.
Yeah. In fact, There's one vacuum I know of that runs its air through a water system, so the water catches the pollens and the dust more, and that's their big sales pitch. And it's a $3,000 vacuum. So, but most vacuums, use air suction and they will have even what's called a HEPA filter, which is a better filter than average. But they're pushing that air and the dust along with it through that filter and out into your room. So essentially, you are getting things off the carpet, making it look neater, but you're pushing a lot of particulates into the air. So when the air quality is bad, leave the vacuum alone.
We wanted to point out, too, as well, that there are any other number of ways. You mentioned this, I think, during the height of the smoke a few weeks ago. You can put a mask on, but it's not always easy to wear.
Right. Yeah, they feel, if you're claustrophobic, you'll feel it, but particularly you're looking for what's called an N95 mask, which is a particulate mask, and I think the other one's called a P100. These are masks that are often used in kind of work situations where dust and other particulate matter they're trying to keep out of the lungs for long-term health, but it works short-term as well to keep allergens out of your nose and mouth, and they do feel hot, but they do make a difference.
You also referenced protecting the eyes, which seemed like an odd one to me.
Yeah, the eyes, one of the recommendations is to wear sunglasses to avoid the irritation of the sun. You don't get as much wind directly on there, but it's not going to stop all particulate matter. One thing you can do, though, is like a saline rinse for the nose. You can get, there are multiple producers of kind of a natural tears kind of a solution. It's really more of a salt solution that you can literally irrigate your eyes out. And so if you have a lot of irritation there, even before I'd jump to an antihistamine that you can put in an eye drop, which is a beautiful thing. I use them once in a while myself. If you'll just use some normal saline that acts like tears to flush out those eyes, that will do you a lot of good because it resets what's on the tissues of your eye. We don't think of maybe the eye itself being mucous membranes, but that's exactly what the whites of the eye are, is a specialized mucous membrane.
I think we're going to be picking this conversation up again at some point.
It'll probably come back, or at least it's haunting people at my house.
We'll see Dr. Jonathan Tripp again soon.
Yeah, see you tonight. Call us 933-4400, and let's have some fun at our cosmetic seminar.
We've got a short break. News is on the way. Bill Colley with you on Magic Valley this morning on News Radio 1310, KLIX, and NewsRadio1310.com. It's 8:59.